Vertical Labret Piercings. Pros, cons, advantages, disadvantages. Going to give you 5 of each coming up next on Pros and Cons by a Piercer, episode number 34. So stick around. For those that are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I'm the owner and operator of the Axiom Body Piercing Studio, located here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So when I talk to you about these things, I'm talking to you with a level of expertise as someone who has done this piercing numerous times and helped people through the healing process. Before we begin and get into the meat of the discussion, the pros and the cons and why you're here, let's talk a little bit about what this piercing is. In essence, what a vertical labret piercing is a lip piercing that is done almost dead center on your lower lip. It can be done either with a ring or with a curved barbell. There's kind of a flip of the coin of whether or not one done with a ring would be a vertical labret or not. But if that's the case, then we're just talking about style of jewelry. If you've already watched my video on lip piercings, it's very similar. You're going to hear some of the same things because it basically is a lip piercing. So let's get into it. 5 pros, 5 cons, 5 advantages, 5 disadvantages. Number 1, we're going to start with the pros. First pro, this piercing is a piercing that has a long history of healing easily and without issue. It does take some care, just like any other piercing, but usually heals out in about 8 to 12 weeks. Number 2, because of the location of this piercing and the angle of this piercing, which is almost vertical or almost straight up and down through the lip where it protrudes out of the mouth the most, there's a very limited amount of contact with teeth and gums in the bone structure of your mouth. So, unlike other oral piercings where you're going to have a lot of interruption or possible risk of causing damage to teeth and gums, this piercing is just not as much prone to that as, say, a tongue piercing would, or a labret piercing, or something that's further down on the mouth, or the piercing is more inside the mouth. Number 3, there's a pretty large variety of different types of jewelry that you can put in this. You're kind of stuck with 2 types. That's a ring and the curved barbell, and I will list that in the cons also. But there are a lot of different ends. There's a lot of different type of styles of settings that you can put in this, and lots of different colors and materials that work well in this particular piercing. Number 4, it's a fairly quick healer. Usually this piercing will heal out, like I said earlier, in 8 to 12 weeks. It's not a prolonged healing piercing like, let's say, nipples or navels or some of these other piercings, but it heals fairly quickly and without a lot of problems. Number 5, this piercing is not going to affect sleep as much as other piercings, unless you're one of those people that sleeps flat on their face. Anybody? No. This piercing is not going to have as much contact with bedding, clothing, etc. It's not, even a piercing off to the side would be more affected by sleep than this particular piercing. Now let's get on to the cons, the disadvantages. Number 1, even with this, as I said, is more outside the mouth, there is always a risk of enamel erosion, gum erosion, and softening the bones inside your mouth. They will always give before, it's kind of metal jewelry versus soft organic tissue, bones, etc., and materials. It's always going to win the jewelry will in that battle. So you do need to take that into account. It can come in contact with front teeth, especially if it is placed correctly. It can also interrupt eating and drinking to a degree. Number 2, I kind of mentioned this already, but you are limited to kind of 2 styles of jewelry. The first one being a ring, the second one being a curved barbell, one of those quarter turns. There's not really a lot of different types of jewelry that you can put in this, like Labret studs and all this other stuff. So it's not a piercing that's going to allow you to put in a large variety of different styles of jewelry. However, as I mentioned in the cons, there are a lot of different ends, different colors, different materials that will work well in this piercing. Number 3, this piercing, like all oral piercings, can tend to lead to swelling. So you will have, during the healing process at least, you're probably going to have a situation where you may have to limit your diet, and I'll get into that later. You may have to put in larger jewelry initially to allow for the inflammation, etc. So this piercing does swell, and it is going to change your eating and possibly a little bit of your lifestyle for a couple of weeks, especially that first 3 to 5 days. That's usually the worst of it. Number 4, this piercing can greatly limit your employment opportunities. It is on the front of your face. There's no way they're not going to notice the thing being there. Even after it heals, there might be a little bit of scar tissue left there that most people will be able to notice. If you are going to be working in anything that's very professional, if you plan on getting a career that's going to be in a professional situation, you may be limited on the amount of employment that you can get. Also, this is not one of those piercings that's socially acceptable. That may change over the years, but it's definitely a more of the fringe element of body piercing, especially when it comes to facial piercings. Number 5, this piercing can close very rapidly. With any oral piercing, you regenerate tissue very rapidly inside your mouth. I've had clients that have had this piercing for a couple of years, went to see grandma or went for a job interview and had problems getting the jewelry back in. It's definitely a piercing that once you put that jewelry in there, it needs to stay in until either they bury you or you decide to abandon the piercing. One final thing, this is not a piercing that's easy to hide. It is right there in the center of the front of your face. No amount of clear jewelry or plastic or glass or what have you, or Band-Aids for that matter, is going to cover up the fact that you have this piercing. So you need to be prepared for that going in. Now let's move on to what I would normally say to you if you came in and asked for a vertical labret piercing, my basic consultation. I'm going to tell you that it's going to take anywhere from 8 to 12 weeks to heal, during which time I'm going to suggest using either mixing up a saline mixture of sea salt and distilled water, or using a sterile saline spray twice daily for 5 to 10 minutes and rinsing afterwards. Also, for the full healing period, I'm going to suggest at least once a day jumping in the shower and cleaning the area with an antimicrobial or germicidal soap twice a day if you feel, or any situation where you feel like you've contaminated the area. I'm also going to, for the inside, suggest for the first 2 weeks that you rinse roughly about 3 to 4 times a day with Biotine antiseptic mouthwash, or an alcohol-free mouthwash that's an antiseptic. Also do warm saltwater rinses with warm water and sea salt twice daily for those first couple weeks, just to be on the safe side. This piercing doesn't affect eating as much as, say, a tongue piercing does, but you do kind of want to stick with some holistic foods that are easy to transfer into your mouth, kind of meat and potato things. You want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things extremely warm in temperature, or anything that may agitate your mouth. Also stay away from sports drinks or sodas or anything that has a lot of sodium in it. All those things are going to lead to swelling or increased swelling. You can cut down the amount of swelling by staying well hydrated, drinking lots of cold items. Sports shakes are really easy. Ice cream shakes, it's an excuse to eat a lot of frozen treats. Also, I'm going to suggest you eat 2 to 3 cartons of yogurt a day, partly because the acidophilus will help keep things in check. There's always a risk when you're rinsing more than you normally would of getting a breakdown of the natural enzymes and bacteria in your mouth and getting an outbreak of a fungi called thrush. It'll coat your tongue with a cottage cheese looking substance, not very comfortable, sometimes has a burning or itching sensation to it, an odd odor. It's not life-threatening, but it's definitely not something you want to go through unless you absolutely have to. And that's why we specify only 3 to 4 times a day with the rinsing, and that you use an alcohol-free antiseptic mouthwash, and additionally eating 3 to 4 cartons of yogurt, because that aphidophilus will kind of help keep things in check. As far as other foods, simplistic foods, figure out what you can handle initially and take it from there. Cross-contamination prevention, common sense stuff. Wash your hands before you handle it. Try to handle it by the ends whenever possible, or the ball. The only time you need to have any contact with this piercing is when you are doing the saline or cleaning it in the shower. Rest of the time, leave it alone. Also, keep everybody else's germy little fingers away from it. At some point in life, you might have been told to spin or rotate jewelry. There is absolutely no reason to do that. Do not do that. It's just going to increase your likelihood of infection and prolong your healing period. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. You are more acceptable to STDs during oral sex, so if you switch partners, practice safe sex the way you're supposed to. So it means latex barriers. Until you've both been tested. And this happens even after the piercing is healed. The lip is a soft piece of tissue. It's not as soft as, say, a genital piercing would be, but you kind of have that same risk that during that activity, you somehow tear that piercing that's healed, you have an exchange of a virus or other form of pathogen, and then suddenly you have an STD. So, be safe, people. Keep your environment clean, clothing, bedding, towels, anything that may come in contact with it. Do not submerge piercing in bodies of water you can't control the quality of, which is pretty much everything but your own clean bathtub. Also, keep pets away from it. Don't let them sleep in the bed with you. They're just germ magnets. Additionally, you do not want to share food items or utensils with other people. Avoid sticking unclean objects in your mouth, like pen caps, toothpicks, etc. Make sure that your own utensils are cleaned on a regular basis. It's generally a good idea to start with a fresh toothbrush after getting the piercing, and store it in an airtight container or somewhere outside of the bathroom. As far as jewelry, I always try to talk about this. There's kind of 2 ways you can go with this particular piercing. Each one of them have their advantages and their disadvantages. You can do it with a ring, which is going to allow you more leeway for swelling. It's going to be a little bit more comfortable in some cases. You don't have to worry about the balls coming unscrewed. You can go with a curved barbell. The disadvantages of curved barbells is that once it swells, it can only swell so far before the balls start impacting into the soft tissue. So sometimes when you do it with a curved barbell, it usually needs to be done slightly larger to allow for the amount of inflammation or swelling that you may see. If that isn't estimated correctly, you could have some serious problems. There's also the problem with the balls coming unscrewed. The other disadvantage of rings is that you have additional movement side to side more so than you would have with a curved barbell. Either way, you can switch and trade jewelry from one to another once the piercing has healed. If you do go with the curved barbell and it's getting caught on teeth or causing issues, I generally suggest going to a shorter one as soon as you possibly can and let your piercer change it. Don't try to change it at home. Let them do it. They have expertise. They've done it numerous times. They know what they're doing. Other than that, lifestyle changes. Of course, you don't want to sleep on the piercing. If using comes out of a spray can or squirt bottle in your hair, you want to shield it with a folded paper towel. Also, you do want to keep cosmetics away from the area, especially powder-based or foundation makeups until the piercing is completely healed. I'm not a big fan of having lipstick or chapstick on the piercing also, so do consider that. I think that's about all I have to say on this particular piercing today. If you feel like I've missed something or I brought up a question that you don't know if I answered, please leave a comment. I generally answer them when I have time. Also, if you've had this piercing and you'd like to share your experience of getting it done in the healing process, please feel free to share. If you'd like to see more of these videos, please subscribe, hit that notification bell so that you can make sure that you see and are notified every single time we post one of these videos. If you like to support the channel and look stylish at the same time, I would suggest checking out our merch store. We have various different designs there from the artists here at the Skin Kitchen and myself. Not only does it show your support, but it also, makes you look cool and shows your body piercing and tattooing pride. Lastly, hope all your piercings heal with ease and without issue. And if you're in the Des Moines, Iowa area, I hope to see if your body piercing needs in the future. Have a good day, everybody.